Hi everyone, welcome back to our MC course. And now we will learn what are the risk factors of falls in older people. This topic is very important because knowing the risk factors will inform us how to prevent or how to intervene some of the risk factors that can be modifiable to prevent falls in older people. So this is the contents of the today's lecture. We will look at what are the learning outcomes, the main terminologies that are used in this topic. We will look at the classifications of risk factors, the internal and external risk factors for falls, and we will summarize the key points of what we have learned today. So the expected learning outcomes at the end of this topic, you should be able to describe the modifiable factors of falls and to identify the risks of falls according to different categories. So before we proceed, let's look at some of the terminologies that you probably will encounter many times during this lecture. The first one is risk. What is a risk? A risk is a situation involving exposure to danger, harm, or loss. In relation to this cause, risk refers to a situation involving exposure of older people to fall. In this context, fall is similar to danger or harm that may cause negative consequences, that is, fall-related injuries, for example, to the older people. Okay, the next term is polypharmacy. You may have heard this in the earlier lecture. Polypharmacy is defined as a regular usage of multiple medicines. Normally, it's more 5 or more to treat different conditions. Next is risk factor. What is risk factor? Risk factor is something that increases the risk or susceptibility of falling. For example, the older person is at risk of falling due to poor vision. The risk factor is poor vision. Next, modifiable factors. What is a modifiable factor? Uh, Factors that can be changed. Factors that can be changed through intervention or prevention. Okay, so we have non-modifiable factors as well, factors that we cannot change. Then we can further classify them into extrinsic factors. So extrinsic factors are factors that are influenced mainly from the outside sources, for example, poor lighting or slippery flow. And lastly, intrinsic factors. So intrinsic factors are those that include genetic, physiological, and pathological characteristics of an individual, for example, weakness of the muscles or poor vision. So now let's look at the classifications of risk factors. There are various ways of classifying the risk factors that increases the risk of falls among the elderly, especially those aged 65 and above. It is therefore highly recommended that seniors or older people aged 65 and over to undergo regular checkup to identify the risk of falls. Early detection can certainly prevent falls and can also prevent various geriatric syndromes. So, what are the common classifications of risk factors of falls? Falling factors can be divided into internal or intrinsic factors and external or extrinsic factors. So what is the external factors? Factors that are related to the body system of the elderly that are usually related to the physical environment. So we have we have defined this earlier in the terminologies. Again, internal factors are factors that are directly related to the body system that are mostly related to changes due to the aging process. So let's look at some of the internal factors of risk of falls. Okay, you can see in the slides, the first one could be too old, very advanced age, especially seniors who are over 75 years old. So age is an internal factor that may not be modifiable. Okay, so age is non-modifiable factor. So a study found that 1 in 3 seniors aged 65 and over or above have or will experience a fall at least once in the past year. The risk of fall is also increasing, especially in those over the age of 75 years old. Why? Because of the um, advanced changes in the physiological system that may lead to limitations in their physical capacity. Next is sedentary lifestyle. Okay, so what do you understand by sedentary lifestyle? Okay, lack of physical activity, lack of exercise. Okay, so sedentary lifestyle may be due to lack of movement or activities, causing seniors to experience a decline in physical ability more quickly compared to seniors who often move out of the house. Okay, so they develop physiological decline due to sedentary lifestyle. Next is living alone. Seniors who live alone are also prone to falling incidents because there is no one to reduce their burden. If they fall, the effects are so severe that may cause death, as they may be left alone for several days at home if they sustain any injuries or fractures or if they hit their head. Right? So next is history of fall. Okay, so the results of a study showed that a history of falls or had a fall before is the most significant factor for the risk of falling again. Because if you remember earlier, we have talked about the vicious cycle of falling. Okay, once they had a fall, they may develop fear of falling that will reduce their mobility, reduce their physical activity, reduce their intentions to do exercises that will further cause physiological decline or physical decline. And again, they are very they are high. They will have high risk of falling again. Okay, so next one is unstable gait. This may be due to muscle weakness, poor coordinations of the leg movements, or due to joint pain. Okay, so these will alter their balance, right? Okay, so we continue with the internal factors. Okay, acute illness. So what is acute illness? They become ill, so sudden, or they develop some illness. Okay, so having acute illness such as symptoms related to stroke, changes in blood pressure due to orthostatic hypotension, changes in the positions that lead to changes in the blood pressure, or having a fever can also lead to fall incidents. Okay, next one, chronic diseases, especially diseases related to the nerves and muscles, and problems such as arthritis of the knee or the hip, vision problems like cataracts, glaucoma, um mental issues such as dementia, non-communicable diseases like diabetes that probably affect their sensory of the lower limb, that they couldn't maintain their balance, that affect their balance performance, and Parkinson's disease because of disorder of their movement that again will also affect their balance performance. Okay, next is cognitive or mental problems. Okay, such as confusions, lack of orientations, and inability to understand something, or memory problems also can lead to false incidents. And fear perception, the elderly perceptions of the ability to perform functional activities for fear of falling also can lead to fall incidents. When they move, they thought that they they think that they may fall. Okay, so this lead them to increase their fear, so when they continue on moving, they may have the tendency to fall because of the perceptions of falling. Okay, and another one is incontinence. Urinary incontinence or inability to control urination can also cause falls, because when you walk, when you have when you present with incontinence, the discomfort, and the consequences of having urinary incontinence, like weakness of the lower limb due to lack of mobility, can lead to false incidents. Again, we continue with internal factors. Alright, so vision problems. Vision problems occur as a result of the normal effects of the aging process, which is very, very common among older people, such as poor visual acuity, intolerance to light radiations, inability to guess the depth or height of floors or stairs, and near vision can cause fall. Okay. Next is muscle weakness. So we know that as we age, we develop muscle weakness, which is very much associated to sarcopenia. If you can remember what happened when you have sarcopenia, sarcopenia is actually a normal aging process, but it can be um, prevented or it can be delayed. Right. So muscle weakness will lead to difficulty in getting up or standing from a sitting position caused by muscle weakness in the knee, hips, and the back. Right? Lack of sensory perception. Lack of sensory perception normally occurs in the feet or heels due to changes in the nervous system, such as postural imbalance, um, slow response. These are the consequences of lack of sensory perceptions. Especially on soft touch, lack of sensory perceptions, especially on soft touch, vibrations, and temperature, reduce ability to act with interactions with other factors such as vision. Okay, older people with hearing problems is also at risk of falling as a result of the aging process, such as presbycusis, especially at high frequency tones, inability to distinguish speech, as well as the effects of excessive accumulations of wax in the ear. Okay, and older people who present with risky behavior. Okay, what is risky behavior? Behavior that likes to someone that like to take risks or do dangerous things, so they are very prone to fall because if you can remember, uh, as you get you become older, you definitely will have some decline in your physiological performances or physical functions. Okay, so which system is the most important for balance maintenance? Can anyone guess? Okay, some book says it's the neuromuscular skeletal systems, okay, which is very true. Right, so here we want to discuss about the musculoskeletal system, the muscles and the bones, which will normally experience a physiological decline due to the effects of normal aging process. This effect will cause the muscles to shrink or decrease in size and subsequently become weaker. Tendons and ligaments will also become harder or calcified, while the spine will become increasingly bent due to osteoporosis. The effects of these changes will cause the elderly to experience impairment to the ability to maintain good posture or body balance. As a result, the elderly are unable to control movement or body balance, subsequently being exposed to falling incidents. External factors of risk of fall. So remember that anything from outside can be considered as external factors. Some factors can be modified, some may not be then they may not be modifiable. Okay, so we look at some of the external factors of risk of falls. Okay, so we have mentioned a few times that consumptions of multiple drugs because of the adverse effects such as dizziness, confusion, muscle weakness can lead to false incidents. So constructions of bathrooms or toilets that are lack support devices such as grab bars, okay, for seniors to cling to or hold on to for body balance when changing movements. Okay, so the toilet design or the bathroom design need to be elder friendly, because most of the time the floor can be wet because of usage of water, right? So it has to be redesigned so that your toilet or bathroom can actually prevent falls. How? By probably designing or fixing grab bars, around the toilet, around the bathroom. Okay. Next is the design of furniture such as chairs or beds that may be too high or too low according to body size, which is not suitable for the ability to function among the older persons. So again, furnitures, chairs need to be according to the size of the body. Okay. Next is slippery, wet, and uneven floors, as well as house constructions with many stairs or different floor levels can cause difficulty for the elderly to walk and make it difficult to use walking aids. And the lighting or type of lighting used may be too bright or glaring, causing disturbance to the visions of the elderly. Therefore, they might not be able to judge or to see the floor, and they will fall. Okay, shoes also is the types or the design of the shoes can also contribute to um, risk of falls. If even the sole, if it is already eroded, there is no gripping effect of the shoes, okay, then it might cause when it meets with slippery floor, then they will have tendency to fall. Okay, so others, the use of a barrier on the side of the bed can also increase the risk of falling, especially when the elderly do not like it or are trying to get off the bed. If they are bedridden or in the hospitals. Okay, so this is quite common. Next, the use of movement or walking aids such as wheelchairs and crutches can also cause the risk of falling if these equipments are not perfect. For example, an aid that is too long may be problematic on the rubber of the side, and inappropriate or unstable height that may challenge the ability to control the postural balance of the elderly. Okay, next is dangerous home environment due to the use of carpets, small furnitures, and objects on the floor. Okay, so you will see that some homes, especially those with children, you can see many obstacles on the floor, toys on the floor, okay, that can cause the elderly to step on it or misstepping and then they fall. Okay, so now we have learned the risk factors of falls. Okay, so the next step is we want to know whether a person or an elderly is at risk of falling. Okay, so next move is to learn how to screen elderly in the community. Okay, so before that, we will summarize the key points of what we learned from this lecture. Okay, so risk of falls can be divided according to internal and external factors. Knowing factors that can lead to fall is important, as it uh, can guide us, healthcare provider, caregivers, even the elderly, in deciding how to prevent or what intervention that is suitable to address the needs. Polypharmacy, poor lighting, and uneven floor. Some of these are the environmental factors, or some of the example of extrinsic factors. Living alone, chronic disease, and musculoskeletal system are some of the example of intrinsic factors. The risk factors of falls, mostly intrinsic factors, can be changed through intervention or prevention, which is known as modifiable factors. Okay, so that's all for today, and we will see you again in the next lecture. Thank you very much.